Today I'll share the patient presentation and case of a young woman who presented with neck and scapular pain as well as headaches. This young woman reported that she had been having these symptoms since college, so for many years. In terms of right versus left in the neck and scapular area, it was about 90-10, and the headache would present kind of both sides of the forehead. She was a consultant who worked long hours seated at home and in office chairs. She has a sit-to-stand desk that she doesn't use, and she notes that it's extremely episodic, lasting for between a few days to a few weeks. She notes that she believes her posture is really poor and that posture is contributory as well as stress and travel. It's worse as the day progresses in the evenings. Turning can be challenging as well. It's hard to make it better when it's there, although she tries massage and stretching, and she's seen other clinicians in the past. When I saw her currently, it was on that right side of the neck and between the shoulder blades on the right side, as well as a mild headache was present. So her verbal history was pretty straightforward and short. When it came to her orthopedic or mechanical exam, I tested the strength of her upper extremities, which were 5 out of 5 in all the major planes. Dural signs at end range, there was some mild tension left and right in the supine nerve tension tests. Her neck movements were the ones that presented with the most difficulty. So the range of motion was not significantly poor, but it was very symptomatic. So protrusion of her neck was not limited, but would cause left elbow pain. Flexion was not limited, but would create left mid-cervical to elbow pain. Retraction, not limited, but would create left upper extremity pain. Extension, I put no loss. Lateral flexion to the right, possibly a little bit of loss. Lateral flexion to the left, possibly a little bit of loss. And then rotation right and left would create scapular pain and neck pain, although again, they didn't seem to be limited on the first baseline test. So based on prevalence, based on her mechanics, based on her verbal history, I did start with retraction extension as the repeated movement for the repeated movement part of the exam, which is the third part of the orthopedic exam that I perform. It created some central neck pain, but afterwards it didn't change. So she started with some right scap and neck pain and a headache, and the more reps we did, it felt a little bit better, and then it came back. But then we kept doing more sets. So we did about 3 sets of 8 to 10 of those retraction extension over the chair, and afterwards her headache was abolished, and her pain had interestingly moved from the right side of her neck and interscapular area to the left side, which is not that common, but it's not a negative sign. It's just something to keep an eye on. We do not want to peripheralize symptoms, and we don't want to make them more intense, but if they move from right to left and stay at the same intensity, in addition to the headache being abolished, that is generally a green light. It's a good sign. In terms of results with her mechanical exam, flexion no longer produced symptoms to the elbow, and rotation bilaterally was less painful. So again, no major loss of range of motion, but what my suspicion is there's something in the posterior neck joints, probably lower cervical spine, that was missing some motion. It just wasn't visible to the naked eye. And again, it's kind of hard to understand spine range of motion a little bit because A, you can't compare it to another spine like you can one shoulder to another shoulder. And 2, because when you move the neck, for example, you're moving lots of different joints. And so if there's a small range of motion loss in one joint, it might not be visible to the naked eye. So we made that the home program, cervical retraction extension over the chair if possible, about 10 every 1 to 2 hours if she could tolerate it. And we talked a lot about posture since we both thought it was likely contributing to her pain. I saw her about a week later. She was very diligent, did her home exercise program every 1 to 2 hours. She said she was much more attentive to her neck posture with her long days of work. She said the strain in her neck with being upright was better, and she started to add the standing desk option as well at home. Her pain was now more central to the lower neck in between the shoulder blades. Her mechanical exam was better. The nerve tension was about the same, again mild, but in terms of moving her neck, the protrusion, flexion, retraction, and extension no longer caused pain. Lateral flexion to the right created some left scap pain, and rotation left and right were both tender, but not as bad as before. So I checked her home exercise program, and the amendment we made was to add overpressure. She was able to tolerate it. So she'd been doing it for a week and doing well. If we want to get to end range, we usually have to add a little bit of overpressure to get the best results. So I explained we wanted to add retraction, extension, and then overpressure on the chin as far back as she could go. Another option is to do some small rotations left and right at the end range of extension to achieve some overpressure to end range. I find that's harder for patients to do, and I've adopted this habit of just using some overpressure on the chin to push. So we spoke about car ergonomics, we spoke about posture again, and that was the visit. She presented a week later, visit number 3. She said that the overpressure for every repetition was too much, causing too much soreness in her neck, so she decreased it to only using overpressure on 2 of the 10 repetitions within the set, but noted that she was much better, only central pain when she did the home exercise program. Posture, she noted, was still difficult to get a handle on, but she was working on it. Her mechanical exam, her left nerve tension felt normal, so better. Her right was better, but still a little bit of mild tension. Again, that's when they're not extremely significant nerve tension signs. It's not necessarily a nervous system problem that's significant with that mild tension. So her home exercise program looked good. She did the exercise correctly. We looked at continuing with the same exercise, but over time being able to take more force. So if she was only doing 2 reps of the set with overpressure, just day by day adding a few more, because I didn't think that central neck pain would go away unless we got more force with overpressure through the neck. But the fact that it is centralized to the neck was a strongly positive prognostic factor. Centralization is one of those things that really tells us we're onto something, and there's nothing that we should really deviate from if centralization is occurring. Overpressure might be the thing that's needed to get it fully abolished. It could just be more reps as well. You can experiment with different types of modalities or treatment avenues, but the end goal is to have no neck pain, full range of motion without any pain, obviously full strength and no nerve tension. So I followed up with her once 2 weeks later, and we focused on another musculoskeletal complaint in her body, but we did briefly discuss her neck pain, and she was consistently reporting still much better, and we decided that we could wean the neck exercise to probably 3 to 4 times a day, and then go down from there to maybe once, maybe twice a day as a maintenance program. Each person is individual to what they need for their maintenance program. Again, it's really based on that person's lifestyle and needs. For example, if you're not flexed a lot during the day, you might not need to go into any extension to balance it out. But if the days where you're really flexed, you might need some extension. The point is understanding the reason for doing that. It's not just doing extension. It's doing extension to make sure you're not losing range of motion, because that loss of range of motion is what is at the cause or the center of the presentation of pain. So I like to tell people I'm not the posture police, I'm the keep your range of motion police. So whatever she needs to do, or whatever a patient needs to do to keep their neck range of motion full and pain-free is the maintenance program. For a lot of people, that's doing the exercise 1 to 2 times a day. For other people, it's, I just watch my posture and make sure I don't flex 8 hours a day in a sustained position. For other people, it's, I'll check my range of motion, and if it's a little stiff, I'll do the exercise to relieve the stiffness. So I educate patients on, let's figure out what you need. Here are some options that I found, but everyone has a different kind of course and a different contributing factor and different lifestyle, different risk factors. But let's do what we need to do to keep you having joints, especially in your spine, that move well and without pain.